Hi there. I checked the doctor's orders, and what he ordered for you is called labetalol. That is a beta blocker. So what that's going to do is that's going to lower your blood pressure. You could get some slight side effects from it. Those could be anything from lightheadedness, a headache, nausea, vomiting, loss of appetite. If you do get those things, just let me know and I can come in and see what I can do for you. He prescribed 0.5 milligrams per kilogram, so I did have to calculate that for you, and I'm going to go ahead and pass 1.8 milliliters of that medication to you. So let me go grab it and I'll be right back, okay? Knock, knock. Hi there, I'm back with your medication here. Before I give this medication, I'm going to go ahead and wash my hands. I'm going to put these gloves on. Okay, so before I give this to you, I'm just going to check a few things here. I'm going to check your wristband, make sure that your name and date matches what I have in my computer. Okay, looks to match. I'm going to go ahead and check and see if you have any allergies to this medication, which you don't. Then I'm also just going to make sure I have the right dose of the medication, which is 1.8 milliliters. I'm going to make sure I have the right patient, which I did by checking the wristband. I'm going to make sure I have the right drug, so I'm going to check the drug here on the vial. And I'm going to check the order here on my computer, make sure I have the right drug, make sure I'm giving the right amount. So I had to calculate because of his weight, and the vial that was given to me was not the correct dose. So I'm going to make sure I have the correct dose here for his weight. And I'm going to make sure I have the right route, which is through his IV push. Make sure that matches my more here, IV push. Okay, so I'm going to go ahead and start to give you the med here. I'm going to uncap your IV, and I'm going to flush that with normal saline to make sure that it is still intact. Okay, still intact, no hurting. Okay, I'm going to go ahead and grab the syringe of the medication here. I'm going to push 1.8 milliliters. Okay, I'm going to unscrew that, and I'm going to place a new sterile green cap on. And then I'm going to go ahead and document that the patient tolerated it with no complaints and no pain, the amount that was given, the time that it was given, the dose that was given, and the drug that was given. We're off to the next nurse here. Here we have a 4-year-old who was admitted to the hospital for nephrotic syndrome. He has some edema in his lower and upper legs and upper arms, and he has some distension in the stomach here because he's holding on to some fluid. I gave labetalol 0.5 milligrams per kilogram every 6 hours, so you can still give it if it is needed. And what we just want to watch here with him is we're going to go ahead and do his daily weights, make sure he's not retaining any more fluid. We're going to go ahead and do strict I&O, make sure he's putting out as much as he's taking in. And we're going to go ahead and do some blood work, continue to do blood work to make sure that the kidneys are functioning correctly. Okay, thank you very much.